Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us. We're going to talk today about skin growth, these unsightly skin growths known as barnacles of aging. And they can appear in some highly visible locations, such as your face and your neck. Well, here on the program to explain what these barnacles actually are and what you can do about them is dermatologist Dr. Michelle Henry. Welcome to the program, Doctor.
Thank you for having me. So these barnacles, otherwise called SKs or seborrheic keratoses, are benign growths, and we actually see them in 83 million Americans, and they can be either raised or flat. We often call them age spots or the barnacles of life, and they're associated with aging. When you see them, they're a little bit raised, they can be a touch waxy, and their color can range from flesh color to pink to brown or black. And I see them in both male and female patients, often in highly visible areas like the face, the neck, or the chest. And although I treat tons of them in my office, as dermatologists, we don't know exactly what causes them. We know that we see them more in the 4th and 5th decade, that their incidence increases with age. We also know that there's a strong hereditary component. So oftentimes my patients that are covered will say, my mom had this or my dad had this.
Now, are these moles that we're talking about or something different?
So they're absolutely not moles. So they have zero malignant potential. They're superficial, benign growths on the skin that have zero malignant potential, and they will not affect your health overall adversely. Oh,
so they don't adversely affect your health overall, but what about some of the psychological effects being on your face, your neck, these highly visible places?
Yeah. So I find in my practice exactly what you said, that when they're on the face, the neck, the legs, that my patients want them removed for cosmetic reasons.
Are they easily removed and treated, or is it a complicated process?
So we've been treating them for decades, and until recently, our only treatments were to either burn them or freeze them, and my patients tend to find that a bit uncomfortable. As you know, I'm here with Escada, and Escada is a 40% hydrogen peroxide solution with an indication for treating raised SKs. And it's actually the first and only FDA-approved treatment for raised SKs. It's to be applied in a doctor's office, so by a credentialed medical professional, using a single-use, soft, pen-like applicator. Now, with all procedures, this is not for everyone. The most common side effects include itching, stinging, redness, swelling, sometimes crusting. However, more severe reactions have been reported. So it's really important that you find a provider that you trust for this treatment.
Is Escada effective regardless of complexion?
So you can use it on all skin types as long as they're raised seborrheic keratoses.
Any other maybe side effects that someone would want to talk about as far as maybe getting into your eyes or accidentally ingesting it?
So they're not indicated to be used on the eyes, or you don't want to ingest it. And that's the importance of going to a trained medical professional. When used appropriately, again, the most common side effects are itching, stinging, maybe a little crusting. And a trained professional will know how to make sure that you avoid the more severe potential reactions.
Is it readily available everywhere as far as insurance is concerned?
So this is a cosmetic procedure. Again, does not affect your overall health. So it is a cosmetic procedure, which is typically out of pocket. And if you go to escada.com, you can find out more information about the procedure. You can also find providers in your area that offer this procedure.
Dr. Michelle Henry, thank you so much for joining us on the program today. And once again, would you give us that website where we can go and learn more about Escada?
So that website is escada.com, ESKATA. And on this website, you can find full important safety information as well as full patient information.
Great. Well, thank you for joining us on the program today. It's been a pleasure.
You're welcome. Thank you for having me.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.